Today we are talking about decreasing pore size. Is it possible, and what are pores exactly? Hi, my name is Dr. Sarah Lynn. I'm a naturopathic doctor specializing in dermatology. So what do we mean when we say shrink or decrease pores? Well, first, let's take a look at the anatomy of a pore in the skin. So here I have a picture of a cross-section of the skin that I painted, and let's just take a look at a skin pore. The first layer of the skin is the epidermis, this layer right here, and then beneath that is the dermis, which is comprised of your blood vessels and nerves, as well as a couple other things. Below that is your hypodermis, which has the adipose tissue, and then on the bottom layer here is just the muscle layer. Skin pores are basically openings of the skin that are connected to a hair follicle or a sweat gland. Here is a hair follicle, and then these here are your sweat glands with the sweat ducts opening into the skin pore. And then on this side, we just have a zoomed in look of the actual skin pore connected to a hair follicle. And so other parts that are important to look at is the sebaceous gland produces sebum, which is a really important oil for your skin. And then we have the collagen fibers and elastin fibers, which are two important proteins that make up part of the skin. Now, what causes enlarged pores? Pores themselves technically do not grow or shrink, and they are largely dependent on your genetics. So technically you can't shrink them, but we can decrease the appearance of pores to make them look or appear smaller. Now, the two biggest causes of enlarged pore size is going to be 1, overproduction of sebum, and 2, a decrease or reduction of collagen. So let's take a look at the first one. So here is your sebaceous gland, and that is what is producing sebum or oil in your skin that is actually really important to keep your skin hydrated and moisturized. But when there's an overproduction of sebum, or this oil, that is causing this pore to get clogged, and it's causing just a buildup that is creating pressure on the sides of the pore and causing it to dilate outward, or for it to appear larger, basically kind of like stretching it out. And then the second cause is reduction of collagen. So here we have our collagen and elastin fibers. Collagen are the long ones, the elastins are like the little squiggly ones. These are important for the matrix of your skin, and when there's a reduction of collagen, that just causes the skin pore to loosen and to again dilate outward. So the therapies that we're going to use to decrease the appearance of your pores are going to be decreasing the production of sebum, as well as building up and strengthening the collagen so that you can tighten those pores. So first, let's talk about decreasing that oil production in your skin. And one of these is just simply going to be cleansing your face daily or twice daily. That's going to be really important for getting rid of that dirt and oil buildup on your skin that is contributing to those clogged pores. So using a gentle cleanser daily and nightly for your skin is going to be really important. And then to do a deeper cleaning, you can use a clay face mask. Of course, my favorite is bentonite clay, and clays like that are really great at drawing out the impurities of the skin, drawing out that sebum and dirt, and really allowing your skin to detoxify and have a deeper cleaning. Going one step further from there is exfoliation. This can be in the form of physical exfoliation using an exfoliative brush, or using a facial scrub such as a sugar scrub or a coffee scrub or other sort of products out there, and that's going to be your physical exfoliation, really important for sloughing off that dead skin. And then second, there is chemical exfoliation, and these are usually in the form of beta hydroxy acid, BHA, and alpha hydroxy acid, AHA. An example of BHA is salicylic acid, and your AHAs are going to be citric acid, malic acid, glycolic acid, and lactic acid. The EWG Healthy Living app rates salicylic acid as a 3, which is pretty good, and then it rates malic acid, glycolic acid, and lactic acid as a 4, which is just okay, not my favorite, and then it rates citric acid, which is also an AHA, as a 2, which is pretty good. So you can find some products, and I'm gonna just show some of them on the screen here that I would be okay with recommending, but you don't even have to do that because BHA and AHA are naturally found in different fruits. So for example, tomatoes naturally contain salicylic acid, and then citrus like lemon and grapefruit contain citric acid, and then yogurt is going to naturally contain lactic acid. So you can make your own natural DIY face masks using some of these natural fruits and products in your own home, and you don't have to go out and buy an expensive product. Another topical product to decrease pore size is going to be vitamin A derivatives. So these are going to be your retinols, and a natural alternative to retinol is Bakuchiol. These vitamin A derivatives has been shown to promote skin cell turnover, unclog pores, and help build collagen as well. So again, here are some vitamin A derivative products that I would recommend that are going to be more natural. Now, ways to internally decrease sebum production, or that oil production, are a little bit less exciting, and they're not going to be as fast of a result, but those I just want to touch on real quick, and that's going to be first and foremost related to your diet. So that's going to be decreasing your amount of processed sugar, processed oils, and overall processed foods in general. Managing your stress and keeping your stress low is going to be really important, as well as keeping your hormones balanced. Now let's talk about ways to build up collagen naturally. One of my favorite topical products for this is going to be a vitamin C serum, because vitamin C is really important for the synthesis of collagen. So that's going to naturally help your skin build up that collagen. And here are a couple of my favorite vitamin C serum products. Another way to build up this collagen is a little bit more invasive of a therapy, and that's microneedling and PRP facials. Now, with both of these, you're creating small micro tears in the skin, which stimulate the body's natural wound healing process, building collagen and making a stronger and tighter matrix of that collagen and elastin. PRP facials, also called a vampire facial, are taking that basically one step further. You're starting with the microneedling process, and then it involves drawing the patient's blood and spinning that down in a centrifuge so that you're left with a layer of platelet-rich plasma, which is also known as liquid gold. And this platelet-rich plasma contains all of the really healing growth factors that are needed for that skin repair and wound healing process. That's going to further increase your collagen and help to decrease those pore size and also reduce fine lines and wrinkles. To summarize everything we just talked to, here's an example skincare routine that you could try to implement to decrease the appearance of your pore size. And that's basically going to start with a morning dental cleanser followed by a vitamin C serum, and then continue using other products in your skincare routine. And then in the evening, you're also going to do a gentle cleanser, and then at this time is when you can apply the retinol or Bakuchiol serum or moisturizer. Weekly or bi-monthly are going to be using an exfoliation, so whether it's physical exfoliation or a chemical exfoliant. You can be doing the bentonite clay face mask or a different type of clay face mask weekly or bi-monthly. And then lastly is going to be using the microneedling or PRP facials less frequently than that. So that's going to be this video. I hope you enjoyed it and found it useful. And if you have any questions, leave a comment down below, and we'll see you in the next video. Bye!